Welcome back again to our youth series. We continue with our mental health discussion. We are still joined by Cassey Chambers today, and we are delving deeper into some of the common mental health issues that face our youth in the university setting. So, welcome back again, Cassey. It's always great having you and having these very important conversations that we don't usually have as a nation. And I think supporting our students, especially now we're almost getting into the exam period, and we know that there will be some kids who are not coping as well. So we spoke about the transition in our previous episode, and I think today we just want to really focus on exactly some of the signs that we should be worried about and some of the common mental health illnesses that we see in this youth group.
So I think if we look at mental health as a whole in South Africa, 1 in 3 South Africans will or do have a mental health issue at some point in their lifetime. That's a lot of people. When we look at young people specifically at universities, we're seeing that it's about an average of 1 in 4, nearly 25% of university students who have a diagnosable mental health issue. That's really significant. And I think we often underestimate the mental health aspect of a young person who's going to university, because our perception is everyone is happy, it's exciting, it's this great opportunity. We don't always see the dark side of that. Actually, we could be seeing symptoms and signs of depression, anxiety, trauma or PTSD, other things such as eating disorders or substance abuse. This is normally the onset of where we see some serious mental health issues. So you might see a diagnosis of bipolar disorder for the first time. So these are the kinds of things that are very common in this age group. The stats are telling that as well. But it's also important to not underestimate the mental health impact on young people, as when we're thinking it only happens to adults, it only happens to other people, but we're seeing it from our stats and even from Discovery's data and the calls that are coming in. It's really serious. And the concern for us is that our young people don't talk about it until it's a serious crisis or it needs an intervention. We have a lot of young people who reach out on our university helplines who are incredibly distressed, deeply depressed. They reach all those assessments and rating scales, or they're even suicidal. And I think that this is what we often underestimate about things like depression or anxiety. If left untreated or undiagnosed, it can lead to something more serious like suicide. And then we're dealing with a whole other different issue that needs crisis intervention and emergency help. So when we're talking depression and anxiety, it's really serious that we treat it early, we get the proper help so that we can prevent it from becoming something more serious or a loss like suicide.
Yeah, and I mean, when you speak about suicide, it's a big one because we know it's one of the top 3, in the top 3 reasons why, young people lose their lives. And I think, there usually are warning signs. And you find that most times when a young person has taken their life, those around them, they say, but we did see some signs, but it's just that sometimes we dismiss the signs because we're like, you're going to get out of it, snap out of it.
Normal.
You're going to snap out of it and life will be fine again, until that life has been lost. And then we're like, if we had done something.
Yes.
So maybe for this episode, it is really about saying, let us not live in regret all the time. Let us not carry the guilt. Let us be proactive and find ways to support. So maybe it's unpacking again exactly what those symptoms and what are those things that we should be looking out for people who are depressed or with anxiety. And I mean, some of the substance abuse issues and eating disorders, you find that they're interlinked with that whole spectrum of mental health issues. So what are the signs? What should we be looking for? And what are those things that we should not be dismissing and saying, it's going to be okay.
Yeah. And hoping that it goes away. And I think with any mental health issue, depression, anxiety, eating disorders, it doesn't go away by itself. It only actually gets worse and can escalate. So I think the first and foremost is for us, even as adults and parents, to understand that depression is a whole body illness. It affects the way that we think, the way that we feel, the way that we behave. So we can often talk about our feelings and emotions, which is what we think of first when we talk about depression, right? It's sadness, it's crying. It could be someone who feels really negative and pessimistic about everything. Nothing's going to work. There's no hope to anything. But it's also someone that could be really agitated. And we see this a lot in boys, where they're very quick to anger, they're quite aggressive. They might even start to be drinking and using drugs or alcohol as a way to cope. So those feelings is what we see, being really sad the whole time, quick to cry for the smallest things. That's the feeling side of it. Then you also have some of the physical symptoms of depression, which we always think it's just something in our head. But depression affects our brain, which is the most important organ in our body, and therefore it would make sense that it would affect how our body functions. And that whole mind-body connection is also really important to link together. So change in sleeping habits. So either you can't sleep at all, or you're sleeping so much and you just have no energy, no motivation. We often understand that teenagers who are still growing and developing need a lot of sleep and rest. But if you're sleeping all the time, and still waking up feeling tired, that's always a big red flag for us as well. So a change in eating habits, a change in sleeping habits, having any kind of constant headaches but no real physical health reason for it, complaining a lot about stomach aches and digestive problems and being upset, that can be some of the physical signs that you can look out for. And then the behaviors, things like withdrawing from family and friends, not wanting to go out and be social, not wanting to come and see friends and family, or wanting to talk to you for a long time on the phone. These are some of the things that you can start to pin out. And I think my biggest point for parents is not to wait till your child ticks all those boxes. Even if you see one, starting the conversation and saying, hey, I'm really worried about you. Are you okay? I've seen that you've been sleeping a lot and you're still feeling really tired. Is everything okay? Sometimes checking in and asking directly can open a real great conversation.
Do you think there's enough support at universities to actually address some of these issues? Do you think we're doing enough to make sure that the resources that are available are welcoming and also are readily and easily accessible and are being used? Because sometimes it's good to have a resource, but you find that nobody uses it, but you continue to see the devastating outcomes relating to mental health, where people will still take their lives. And you find that they never ever reached out. And these services are available. So do you think, what can we do better and more, even just from the institution side, but also friends and family of those students who may be struggling? How do we change the course here?
And that's such an important conversation as well, because we often look as the university as you're going there to study and get a degree or learn, but we have to have these mental health resources because you can't exclude it from our overall view of our young person. But I also think when we look at mental health in South Africa, we have to do more about breaking the stigma so that we can encourage our young people to access the resources that are available, because they're not just available at university. That village, again, family, friends, your doctor, resources that are available. So if we can see in talking more about mental health, we break the stigma and we're encouraging people and improving some of that help-seeking behavior, that's the first step. When we look at universities, yes, there are student support services available. It's knowing what they are and how to access them and where they are before there's a crisis. So when you're doing orientation or before exams, even if you feel like you're never going to need them, find out what the number is, find out where they're based, how to make an appointment. So if you do need them, you know immediately where to go. Because often when you're in that crisis and now you're having to find numbers and it can be overwhelming. So be prepared in finding out how to access those resources at that university. SADAG also has over 11 different dedicated university helplines for various institutions in South Africa. Free telephone counseling, 24 hours a day. So you can always access and tap into that. That's awesome. We also have a higher health learning platform where anyone in a college or a university or an institution can access free mental health. So those resources are available. It's about connecting a young person to them. Sometimes there's a lot of stigma on campus because you don't want to be seen as going to the clinic to get counseling. You don't want to be seen by a fellow student or what have you. I think it's having to have those conversations and to tackle it beforehand to help break the stigma. That it's okay if we're having to go to the doctor for health reasons, therefore it's okay to go for counseling. I think when we're looking at what we're dealing with as a country and the stats that we're having, mental health is a huge issue. We have to be doing more. Is it enough? No, because we're seeing that there are still too many young people who are taking their life and too many families who are devastated. So having resources on campus is not the only thing that we need to be expressing. We need families to link more resources and communities, more support. And I think the more we can do that and encourage help-seeking behavior, we can start to see a decline in the stats at the moment, which are just increasing and growing every day. So more is always needed, but there are resources. We just have to let our young people know how to access them.
So, Cassey, I think the challenging piece is that these young people leave home, so we don't see them, so some of the warning signs may not always be visible because they're not next to us as parents. And we also know that they are tech savvy, they rely on online tools. So maybe how can we then equip the parents, firstly, in terms of their check-ins, or where there is no real good relationship between a child and their parent? What other ways? I mean, you are a friend, you've got a friend that you are worried about. How can we support in that context, knowing that you're not close to your child, and also understanding that these are people who are tech savvy, they may rely on online tools. What online tools are available so that we make it easy for them to access help?
It's so true. We have a lot of young people who are now becoming adults and becoming independent. So they're not sharing too much. They're not communicating. You're also, as a parent, not their number one priority at the moment. It's about friends. It's about varsity life or a significant other. So how do we actually check in if we don't have all the information, we're not chatting as often, and we're not seeing them as often? I think the first and foremost is to just share the resources. And this is where we're tapping into the friends, right? If you have a friend who's isolating themselves, who's not coming out of their room, who's not coming to lectures, you've seen a drop in their performance, in their social ability, it's to check in and say, hey, I'm really worried about you. Are you okay? So kind of equipping our friends, our fellow students on how to do that check-in. If you're a young person, your child is not reaching out to you and communicating, you don't have to call the ambulance and access that help. But it's just to encourage them to reach out. So whether it's forwarding them, here's the contact details if you ever need to speak to someone, or I know you don't want to speak to me, but speak to a friend, speak to your cousin, speak to your best friend, get them to check in. So at least they're talking to someone and they're kind of gauging how they're really coping. I think in this new world of tech and online, we're wanting to access information whenever we're feeling it, like down or lonely or isolated. It could be 10 o'clock at night. Who do you speak to? You can't phone mom, you don't have a friend. You can reach out to SADAG or even online resources. There's various different options such as peer support groups, which are online, so you can connect wherever you are in the country. You can also chat live to a counselor via WhatsApp. So sometimes picking up the phone can be really daunting, but you can chat and say, I actually don't know what's going on, but I don't quite feel the same. What help is there? And you can use it via WhatsApp. So using our online tools, using social media to help our mental health, not just getting lost in that rabbit hole of just random videos, but actually going and accessing some of the tips and tools and resources that are available to help our mental health. Again, as a parent, your role could be in sharing those resources. Here's a helpful podcast. Here's a helpful website. Here's a helpful support group that I found that you might be interested in. Sharing it over and over again could be our role in providing those resources to our young person.
That's awesome, because you can share when they're actually saying we are fine. You say, I'm sharing anyway.
Exactly, because you never know when they're going to need it.
No, definitely. Thank you so much, Cassey. This has been so insightful, and such an important topic. So thank you again for joining us. I think some of the highlights of this talk have been around the support that we need to give to our young ones, how to identify some of these warning signs and make sure that we are there for the ones that we love and we intervene at a time when they need us the most. So thank you so much, and join us again for the next episode of our youth series.